my name is Said Abdulrazak, and I'm the co-presenter for this particular workshop. And just like what my colleague has rightly said, that the purpose of this workshop is to actually prepare us on how we are going to basically analyze our project work. But during the course of the meeting that we had, when we are preparing to when we are preparing for this workshop, so we decided to like um, add up project work into it, like project present what was the project write up, in order for us to be able to, at least to some extent, know some basic things that will be beneficial during the course of our research work. So in order to not to waste much of our time, I will be discussing with us this afternoon on the basic tips in project writing. So, as my colleague has rightly said, so this particular workshop is not to make us to become an expert, but it's going to help us in one way or the other to be able to develop, develop us in how on how we are going to write projects, and at the same time to be able to analyze research data basically. So first and foremost, I think it is very important that we also look at the basic things that we need to know in project writing. So when we are talking about project, for undergraduate we call it project. So in postgraduate area, they can revert it to another term which we call a thesis or dissertation, as the case may be. But for the case of for the purpose of what of this workshop, so we'll be looking at projects. So what are the tips that we need to know in writing projects? So this slide, okay, these are the outlines that I'll be following. First and foremost, I want us to know that writing projects, you actually need a template. So like especially undergraduate projects, because what's very important there is that if you are even in postgraduate, if you are going to write any project, we need a particular template that we are going to use, like a format that will guide us to writing the project. And following this outline, this in every cases, we do normally have projects in this particular orders. So we do normally have it like this. We do normally have preliminary pages, chapter 1 to 5, references, questionnaires, conclusion. So this one is just the basic content of what project supposed to go. In postgraduate studies, there might be some differences. Now, looking at the preliminary pages, the first one, under the preliminary pages, these are the contents that should be contained under the preliminary pages. You have the title page, we have the declaration, certification, and so on up to table of contents. Now, under the preliminary pages, the title page usually contain the research project title. So I think I would like to project a sample of a work that shows that. Okay, so looking at this is actually a sample of a work of a research work. So this that you are seeing is the title page. You can see the topic of the title. We have artificial intelligence in medical practice among health workers in University of Abuja. So the next page is the declaration page. Now, before I go forward, under the title page, what's very important there is actually what research topic. One of the things that is very important is how we go about choosing a research topic, because the research topic is actually very, very what important. And I will like to actually give you this hint on how we can actually choose, though to some extent we might have one or two research topics going on in our mind, but it's also very important that we know the basis on how we can choose a very good research topic. So in this case, I will, from project as what as it entails. The word project is actually an epidemiological research. So which then means that if you are talking about epidemiological research, it means we are dealing with what? Epidemiology. So now, based on what we have been taught on epidemiology when in the community medicine, what we mean by epidemiology is that it is the study of the distribution of disease and health-related events in a specified what population. And when you do this, you want to use it to actually prevent the occurrence of disease or health related events. So the reason I'm saying this, just for us to be able to know how we choose a research topic. Not like I said, epidemiology is the study of a disease or health related event, meaning that at one way or the other way we are going to have, okay, if we are going to choose a research topic, we should have one or two disease or health related events in our mind. Disease can either be communicable or non communicable. And when we are talking about health related event, you all know that maybe road traffic accident or hypertension, maybe safe food hygiene, and all sort of that. So all these, they are what? They are part of what your project topic should contain. So your project topic should contain the disease or health related what? Top events. Then not only that, inside the research, project topic, it should also contain the specified population where you want to actually carry out the research work. So looking at this topic now, we have artificial intelligence in medical practice among health workers. So the word artificial intelligence in medical practice is a form of health related event among who? Among health workers, which is actually the specified what? Population, University of Abuja Teaching Hospital. So I'm just saying this so that if in case we want to choose a research topic, we should try and make sure we want to consider the definition of what? Of epidemiology in order to what? To be able to come about a good research topic. So going further, so I'm not going to be explaining all this. So I'll just only give you the little insight on the important ones. So like I said, when you want to write a project, you have a template. So when you have a template, all these ones are part of the template. Like this one I'm showing you now is a template of a research work that you can use for your own. When you can get to the declaration, this the what's called the template of how declaration should be. So your own, you all just need to do is what? To copy this and paste it into your own research work. So and so on like that. Certification, the dedication up to the table of content. Though, okay, yes, abstract. Abstract, before you can write abstract, first, your project has to be complete. It is when your project is complete that you can form an abstract. You can see under the abstract, we have the background of study, the methods, the results, conclusion. So all these, you cannot form all this without your project topic being complete. So that one, we are going to look at it at the end of the presentation of this project writing. So the next page, okay, chapter one. So chapter one usually contains this. So we have introduction. So introduction is all about background of study. We have statement of problem. So what we mean by statement of problem is just trying to discuss what the, maybe take for instance now, you are dealing with a research topic that has to do with knowledge, attitude, and practice of, let's say, hepatitis B vaccine among University of Abuja, students. Let me come again. Knowledge, attitude, and practices of hepatitis B vaccine among what? University of Abuja students. Looking at that research topic, so we are talking about statement of problem. Statement of problem is just referring to how you just, okay, in your research topic now, what are the problems that you think is what is actually going for you to now come up to it, that particular topic. Maybe some people do not have much knowledge about HB vaccine, or maybe you notice that maybe attitude of some students towards HB vaccine is actually very low, or their practices towards is very low. So these are actually a problem. So now, by the time you are now trying to write it as a statement of problem, you now try to you are just trying to discuss on the what? On the knowledge of students about it. Is the knowledge low or high? In this case, it's going to be low because it's a what? It's a problem. Are you getting it now? So let me just, okay, let me show you an instance here. So going with this research, sorry, let me open another research work. So this one is actually on awareness, knowledge, attitude, and perception of menopause among women between the age of 45 to 60 years attending University of Abuja Teaching Hospital. So let me just scroll down to the statement of problem. So in this one, is dealing with the women between the age of that's reproductive age. So whether it's dealing with with their knowledge, attitude, and practice. So looking at the statement of problem here, so you can see going through this one now. So from the information we have there, it said despite the significant impact of menopausal syndrome on women's health and quality of life, there, there remains a lack of comprehensive awareness, understand. So all this one, we are just trying to come up with discussion on the problem that you feel is actually going on in your among the target, the sample that you actually want to carry out the research work on. So the next one is now, sorry, before I move further, like I said, in chapter one, we have the first one, which is introduction, which is background of study. How do you come about this? First, after you have been able to identify, okay, this is the topic I want to work on, then the next thing that is also very important is how are you going to search for this research topic? Now, we have various websites that we can actually use to search for works on research topics. First of them, we have Google Scholar, so which we all know. Some of us are conversant with it. So we also have ResearchGate. Google on its own is also another form of website, site that we can also visit when we are like trying to search for works that we need for our project work. But out of all these three, Google Scholar is actually the most very important one. Why? Because from Google Scholar, you can link you to a lot of other sites where you can get materials from. So now, this particular introduction now is actually from a particular research work that is being gotten from either Google Scholar, ResearchGate, or what have you. So what happened is that this particular introduction is actually copied. Let me open one research work. Okay. So this research work is on knowledge perception of healthcare workers towards the adoption of AI in healthcare delivery in Nigeria. So now looking at this now, this is the introduction. This introduction, you just copy this introduction like this and paste it. Let's say you are working on this particular research work, just copy it. To some extent, some people might say, I don't like it like this. What you just need to do is just now people are using AI a lot now. Just carry the whole thing and take it to AI. AI can help you to modify this whole this whole essay, this whole work. But I think it's very important because of time. All you just need to do is just copy it, paste it to your own work, and then you are good to go. So then the next thing is scope of study. So that one is just talking about the vicinity through through which you are going to get your sample. Let's say, for instance, you are working about student of Abuja in teaching hospital. So your scope of study is going to be on the University of Abuja student in the teaching hospital, not beyond that particular scope. The justification of study is all about relevance. Okay, how relevant is your work? Like how can you justify that this particular that your study is actually of significance? So sometimes some supervisor will tell you that okay, justification of study is the same thing as relevance of study, significance of study. So let me open a particular work here. So this same work on knowledge, attitude of reproductive women or menopause. So let's look at this justification. This justification is just trying to talk about how significant or relevant your study is. So this one too is not far-fetched. All you just need to do is okay, identify the knowledge gap. The knowledge gap is maybe there is reduction in the knowledge or attitude or practice. Then how can you tackle it from your own study? So maybe probably after you have been able to identify that okay, we have low knowledge, low knowledge, low attitude, and low practice, then the next thing you now want to talk about how this particular study, because by the time you know all this, then you now know, just like from epidemiology, don't forget, epidemiology, you want to like use the study to be able to identify a problem. Then after you have done that, then what do? You want to prevent the problem. So this is what justification is trying to come about. You identify the problem, then you want to solve it out. So that's just the statement on that. Then the next one is aims and objectives. Yes, very important. In fact, before I move on for my presentation, I need to let you know that there are three, like when writing a project, you should have three things about your mind, like three, let me just call it three backbones of a project. Three backbones. First is your specific objectives. There should be a connection between your specific objectives, your literature review, analysis, and discussion. You see, those four, they are very important when writing a project. In fact, if you don't know anything in your project at all, when you know those four, your specific objective is actually very, very what? Important. Specific objective of a project. Then another thing that is very important is your literature review. That's especially the review of previous studies. Then the next thing is what? Is the proper analysis. And the last one is actually the discussion. So now, looking at these specific objectives now, specific objectives, you can actually, like come up with specific objectives from your research topic. Now, this research topic is on knowledge, attitude, practice of menopause, or about menopause among the productive age women. Looking at these specific objectives, you have what? You want to determine the level of what? Awareness. You want to examine the women's attitude. What, it's still part of what? The topic. You want to do what again? You want to identify the common practices, still part of what? The topic. Then you want to, though sometimes the topic might not actually contain, sometimes you might not actually, like extract your objectives from the topic. It depends on how the topics comes. Majority of the topics nowadays are usually based on, let's say, KAP, knowledge, attitude, practice. Some can be PP, perception and practice. Some can be awareness, knowledge, and attitude. It depends. It depends. So, and it also depends on your what? On your examiners, what your examiners also want. Though, by the time you start this project, your examiner is actually your guide. So whatever he tells you to do, or he or she tells you to do, you have to follow it. Now, another one we have here is the specific objectives that doesn't follow the topic. You can see the last one, to assess the what? The influence of demographic factors on women's knowledge, attitude, and practice. So now, just like my colleague has rightly said, because of the overview, by the time we start the analysis proper, we are going to be looking at three basic analysis. That we'll be looking at descriptive analysis, which sometimes we call it univariate. We'll be looking at bivariate. In this case of bivariate, normally use what we refer to as chi-square method. So this chi-square is what is actually used in most cases to look for association. So when we get to that work, we look at it. So now this last one is trying to talk about what? Influence of demographic factors. So when you want to look for influence of anything, or effect of anything, or association of anything, we normally use bivariate analysis. So when we get to that, we explain proper. So that is that about what? About chapter 1. Then chapter 2. Chapter 2, we have basically in chapter 2, what you normally have is overview of the what? Of your study. That's the topic of your study, and the review of previous studies. In some settings, they normally had what we refer to as theoretical framework into it. So I don't think I'm going to actually dwell into that, because in our own setting here, and from experience from the few works that I've actually seen, they did not actually make use of what theory. They did not actually talk about what theoretical framework. So I'm not going to talk about that. So what we just look at here basically just the overview of the research topic and review of previous study. Now let's look at this research work again. This research work is actually on, this particular one is actually on the knowledge, attitude on menopause. So if you're talking about overview now, overview in the sense that we want to overview, menopause is actually a topic on its own. We want to look at overview of what? Menopause. So there are textbooks. In fact, if those textbooks, you can still search for it on what? Online, maybe Google and all that. You see, information about menopause. Maybe probably you start from, okay, what menopause is all about, the factors, all those stuff. Those are what we refer to as just like concepts of what? Of a menopause. That's what that overview is trying to provide. So in your literature review, what your supervisor is most likely interested in is to see the concept of your research topic. Then the other one that's also very important is review of previous studies. You want to review the past works that are your research work. There are people that have actually worked on it before. Just like there's a particular phrase that you see on Google Scholar, that's standing on what? Standing on the shoulder of what? Of the giant. So meaning that there's no any research work that you'll be writing that have not been carried out by some people before. So what we now do is that in this review of previous study, you want to cite their work. But then you now cite it, then you now put it into literature. Now, how do we cite? So I've cited an example there. So let me open a research work here. This is a research work, a publication. So now this research work, now you can see the respondent knowledge of artificial intelligence. Now, sorry, before I move further, I said something initially. I said there's the backbone of the project. First is that what? You need to identify your relevant specific objectives. Followed by what? The literature review. The literature review here, what they are referring to is the review of previous study. So there's actually a connection between the specific objectives of study and what and the review of previous study. So you need so anytime you are writing review, you are writing a review of previous study. What will guide you, what will serve as a guide for you to be able to write it is what is your specific objectives. Now, specific objectives for this particular work is you have the first one, you have level of awareness and knowledge. Okay, let me open this other one. So the specific objective you have here. Okay, sorry, I missed something out. That's research questions. Research questions, you can derive research questions from specific objectives. Are you with me? So research question, what you just need to do, question, you form a question out of your objectives. That's what research questions is all about. Now, looking at these specific objectives now, we have to determine the level of knowledge of AI, that's artificial intelligence, among what? Among the respondents. Now, come to this. So looking at this publication now, how do we cite? So, like I said, we want to cite someone's work on what? On knowledge. We said if we want to write review of previous study, we use what? Specific objectives. Now, here are our specific objectives. We have the first one, level of awareness, to determine the level. Now, another thing, when you want to write specific objectives, you need to always start with to, preposition to determine the level of awareness, to examine women's attitude, to identify. So that's what is normally used. So it's very important to also take note of that. Now, the first objective here is what? To determine the level of awareness and knowledge. Sorry, I'm opening a different. So to determine what? The level of knowledge of what? Of AI among the what? The respondents. Now, we want to cite a literature review, a past studies on what? On level of what? Of knowledge. So this is one work on it. So now, this work now, you can see respondent knowledge of AI. You have out of 263 respondents. So blah, 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 blah. So this one is just, so now look at this instance now. So we want to cite a literature like a review of study. So you follow this format. You can see, according to a study conducted by Said et al. You know, sometimes you see a lot of, like other co-authors. Just put et al. Instead of writing everything, just put the first one, then not put, just put et al. On the assessment of awareness, perception, and opinions. So looking when you want to cite, first thing that's very important is first the topic of the previous work is very important. When citing a review of study or literature review, rather in this case, the first thing that is important is the topic of the previous work. Then the second thing that's also very important is yes, the year. I didn't include the year here. Year is also very important. You indicate the year that particular study is what is carried out. So then another thing that is important is also the what? What are the findings that they got? So those three things, they are very important when citing review of studies. The first is the topic of the past work. Then the second one that's very important is the year the research was carried out. And the last thing that's very important is the what? Is the findings. So looking at this instance now, we have the top. What's the topic there? Assessment of awareness, perceptions, and opinions towards what? AI among healthcare students in Riyadh, Saudi Arabia. Now, their findings is that what? They what? Most of the students, that's about 73.9%, knew about what? AI. Then in addition, 69.4% thought that AI is a tool that helps. So these are the findings. So you look at the topic, though I didn't include the year here, but here is also very important that you need to take note of when citing review of previous studies. So that goes like that with other specific objectives that you want to cite from the previous studies. Now, chapter 3 is all about research methodology. So now, that's how do you design your research. So these are the outlines for the chapter 3. You have the study area, that's the area through which you want to carry out your study. Study population. Now, among the population that you want to use, the inclusion and the exclusion criteria, you need to also take note of that. The study design. Now, I'll not be talking about all this. Why? Because all of their format for all this. If you see any format, you'll be able to understand all this. So in case anybody needs format, you can DM me. I will send the template through which you just go to, then you understand. But what I'm just going to talk about here is study design, sample size determination, sampling techniques. Then the rest, maybe probably I might just make one or two statements on it. So study design is the one of the very important things that that you need to know in this. That I'm going to talk about in this research methodology. What do you mean by study design? We have been taught in community medicine the different ways of study design. So we have descriptive, we have analytical, we have experimental what design. But in this case, most of the research work that is being carried out in our setting here is just one form of or one type of study design. That's cross-sectional what study design. It's a form of descriptive anyway. So we all know what cross-section is all about. So during the time of Mercy, they said we want to go to what to a particular what that's study area. We administer the questionnaires or whatever we want to administer. Then we collect the data and we leave. That's a snapshot. So most of the study design or every research work that is being carried in our setting here, I'm not talking about other settings, is actually what cross-sectional what design that is actually used. In other sphere of maybe specialization, you might be using what we refer to as experimental design study and so on. But in our own setting here, it's cross-sectional study design. So let me just open a particular work to show you that. Okay. So study design. So you can see a descriptive cross-sectional study was employed. Now, sorry, please, before I go further, first, before you start, when you want to start your project, they will ask you to write a proposal. So the difference between proposal and your project proper is just tense. Tense in the sense that in English, so that's proposal, the project that you have not carried out. Are you getting it now? Then use what? You use a future tense. Okay, like in this case now, a descriptive questionnaire study, instead of saying was employed, if it's a proposal, I will say will be employed. So when you are writing your proposal, you will not be using past tense. What you're using is what is future, or sorry, is it future? Is it future tense? Okay, it's future tense. So instead of was employed, just say will be employed. So in your proposal, the only thing that will changing in your proposal is just chapter 3. So chapter 1, chapter 2, you are not going to change anything. Chapter 1, chapter 2 will also be exactly like that in your final project. But for your proposal, when writing your proposal, is your what? Is your tense that will change at the end of the day. So, like I said, study design, in most cases here, what we use is functional study design. So then the next one is sample size determination. It's also very important. How do we determine sample size? We have like different formulas of actually using, that we can use to determine sample size. We have Cochrane's formula, we have Leslie Kish, we have Yame's formula. They are plenty, but majority of the formula that we normally use in our own setting here is either Cochrane's or let me just open it there. In our own setting here, majority of the formula that the formula that is normally used is either Cochrane's formula or Leslie Kish. Both of them they are almost the same. They are almost the same. In fact, they are the same. They are the same. The only thing that just there is that this Q, you can see N equals Z squared PQ over D square. So the only thing that is different there is that this Q is changed, they change the Q into 1 minus P. That's the only thing. So they are both Cochrane's and Leslie Kish. They are virtually the same. But Yame's formula now, how do we now determine sample size using this formula? You can see we have N. N represents the minimum, that's your sample size now. Z is constant. So I don't want to be talking too much on that. It's constant and the value is 1.96. That's for Z. YP is proportion of prevalence. So now, what is constant in this formula is Z and D. Z and D. Those are the two things that is constant. Z is 1.96. YD is 0.05. So if I send the format, maybe probably anybody that needs it, you see all those things. And anybody that also has password, you can check it up. You see it there. So then the P, so what we determine here is P, which is the proportion of prevalence. Now, how do we determine proportion of prevalence? Before we can determine sample size, we need a past study. We need a past study. In that past study, we now look at what is the prevalence. Let's take, for instance, now, our research work is on knowledge, attitude, practice of menopause. Are you following now? You can see the heading there is actually knowledge, attitude, and practice. So let's take knowledge as an instance. So now, we now go out, during the course of your literature review, when you are starting for past work, so you must have come across different research works on knowledge, attitude, and practice of menopause. Are you following now? So now, we now look at one of the work. What is the level of knowledge? Like, you check in the abstract. Let me open one for you. So let's look at the abstract of this one. No, this is a different topic anyway. This topic is different. This topic is different anyway. Now let's look at the result in this topic now. What do we see there? They said data percentage, 25.5% of, okay, I don't need that. What I need is knowledge. Out of 263 respondents, are you seeing it? Sorry. Okay, you can see this out of 263 respondents, 51.7% had good knowledge of AI. That's the only thing I want to pick. I said, let's take for instance, our research work is on knowledge, attitude, and practice on AI, or of AI rather, among what? Among the medical personnel. I said, now we want to form, or we want to what? We want to calculate sample size. How do we calculate sample size? We still make use of what? Of past study to calculate sample size. Now, after we have downloaded our past works, this is actually one of the past work. So now, here now, like I said, our research is on knowledge, attitude. Are we following now? Let's singular knowledge on its own. Let's leave attitude and practice. So that knowledge now, like I said, what are we finding? We are looking for, please, let's like, what's it called? Let's photo let's let's have the picture of this formula in our brain. N equals Z squared, PQ over what? D squared. Like I said, Z and D, they are constant. Are we following? So what we need is what? Is P. And what is P? P is what? Is level of the prevalence. How do we get level of the prevalence? We said, like I said, we use past study. We use past study. Now, in this past study now, the prevalence of the level, or the prevalence or level of knowledge here is 51.7%. That means the P. That means, let's say we want to use this work now. This is our P. This is what we use as what? As P. That's 51.7%. So if it's another work entirely, maybe you see 60 point something, that particular percent is what we need. Now, that 60 point, let's say we have 51.7% now. Let's go back to our formula. Now, there's no any writing material. So, there's no time for that because of, okay. So, let me just continue. Like I said, P, let's say our P here is what? 51.7%. Are we following now? So, in that case, we are going to convert that P to decimal. Okay, let's still use this one as an instance. So, in this case here, from the previous study, the prevalence, you can see the p-value of 44.7%. They cannot call it p-value, prevalence, or level, anyone, any, they can use any term for it. So the p-value here is what? 44.7%, which is the prevalence from a previous similar study. That's a work that has been carried out that's also similar to this particular work, and it has been referenced. When we go to reference area, we explain that all these reference format as well. We have 44.7%. You convert this 44.7 to decimal. So if we convert 44.7 to decimal, we are going to get 0. What? 0.45. Okay, 0.45. So now in this case, I think there is error in the calculation here. So now in this case, they got what? 0.6. Now our Q is 1 minus what? P. So that means we are going to have what? 1 minus what? 0.6. We now get Q to be what? 0.4. So whatever you get now, you substitute everything into the formula. At the end of the day, we arrive for this particular work now. We arrive at 369. That's our sample size what? Determination. That's how we arrive at what? Sample size. Now we have 369. There's something called 10% non-response rate. Non-response rate is the that you want to be on the safer side. Okay, let's take for instance now, we are thinking that what if at the end of the day, some people maybe during the course of administering questionnaires, some people they do not later what answer it. You get, you want to be on the safer side. You now do what we call 10% non-response rate. So what is 10% of 369? 10% is what? Is 37 if you calculate this very well, of 369. That 37, you now add it up to 369. By the time you add it up, you get what? 406. Actually, your minimum sample size is 369. But be on the safer side so that at the end of the day, if in case some people do not probably answer the questionnaire, you still arrive at your own 369. Unlike when you just dish out only 369, and some people do not later attempt it. You can see that at the end of the day, you are going to have maybe some questionnaires or answers. But when you distribute more than what you need, which we call 10% non-response rate, then you are going to You are going to have at the end of the day, you are going to know, you still fall on what? On your minimum sample size at the end of the day. So that's that about what? About that. So the next one is sampling technique. Sampling technique is also very important. Now, in our community medicine, they taught us yes, sampling technique. And if I remember, we have majorly basically two types. We have yes, we have basically two types. We have random and what? And non-random. So now for the random, basically for our own settings here, there are two major random sampling. I mean random sampling techniques that people normally use. We have the multi-stage, we have the stratified. Those are the two basic. And then to some extent, some people use systematic random sampling techniques. So in other way around, some people use non-random. And non-random has to do with what? Maybe probably convenience, based on your convenience, or maybe purpose. So, but the difference is that when you want to use random, you should know that random, like what's called? It's there is no what bias in the case of random because you are selecting people randomly unlike the case of non-random. So the preferable one in most cases by most of the supervisors is actually the random sampling techniques. So we have the method of data collection. What method do you want to use? Is it questionnaire based? Your questionnaire is it semi-structured or structured questionnaire and so on. So when you look at the template, you see all this one there. Your data analysis, how do you want to analyze? So your analysis starts with descriptive, followed by what? Followed by the bivariate, which involves the use of chi-square. So all this, we explain it in what? In data analysis. You can put all those two in what? You can see all this in the format. So ethical consideration has to do with how you get your ethical approval, then limitation of study. So when you see the format, you get to know all those. Then chapter 4 has to do with the result. Before you can arrive at the result, first you need what? You need to have analyzed your work. So after you have done the proper analysis, then you now come up with what? With a result. And the result is usually the one that contains series of tables. You can see this is the result. So this is the result now. So you can see it contains tables showing the result and how you also interpret those tables. So the information under it represents the interpretation of the result. Then chapter 5 has to do with discussion. Yes, like I said, now discussion also has a little bit of works. What is very important in discussion is what is very important in chapter 5 is discussion. In discussion, what you do is you are comparing your own work with the past work. So and you find it easier when you already have a review of previous what studies in your chapter 2. So all you just need to do in discussion is you will be comparing your own work with their own work. Maybe your own work, you get that okay, the level of knowledge is high in your own work, and the past work is low. You now say, okay, my own study, okay, the current study is similar to so study, or the current study is not similar. These are the language you'll be using in discussion. So I have a format that I can send across for you to see. So conclusion just have to do with the conclusion of your research work. Then you recommend at the end of the day. Then another thing that's very, very important is the reference styling. In our own setting here, the reference styling that we use is Vancouver. In other settings, we have upper format and so on, or Harvard and so on. But in our own setting, it is Vancouver. So Vancouver just have to do with using number to actually reference your work. Using number to reference your work. You can see superscript. The number is in superscript. So this is 58. So meaning that this particular study now, okay, like this one, and this is a perfect example of a citation of a work. Now, mind you, yes, I remember now. When I was showing you the citation format of a review of study, I said one of the things that's very important is the inclusion of the year. But because of the style of reference that we use in our setting here, some supervisors will tell you that remove the year, they don't need it. Why? Because this particular reference, by the time you go to this reference, you'll be able to see the full reference. By the time you go to this number, this 58. So when you go to reference page and you locate this 58, you see the full reference citation of this particular work. So that's why some supervisors will tell you don't include number. But if you include this, some they don't care. But as students, sometimes we will maybe using words that we be using outdated words. And when you are using outdated words, that is to say, words that are not recent. Like some supervisors, they don't like any word that is outdated. They want recent words. So in that case, by the time you include the year, you are already showing your supervisor that your work is outdated. But if there is no year there, students now, especially during the time when exam is approaching, you don't want to because at a point in time, I would not like to. Some people still like their work will still be slow because supervisors they are different when it comes to what to like attend to what to students. Some will attend to students very quickly, some will attend to students very late. So what I'm just trying to let you know is that sometimes some may prefer you to include here while some will not prefer. But the beauty of not including here is that if your work is outdated, they will not see it. They will not see it there. So this number alone has represented the reference page. I mean, sorry, the reference number through which you can get your what. So I said Vancouver. This is how Vancouver looks like. Now we have ways of referencing. There are some apps that you can use to reference. So we have Zotero. There's one again that I cannot remember, but I don't normally use them. Why? Because first you have to be connected online when you are using them. Though they have advantage over manual. I use manual referencing, manual style. If it is automatic reference that you use, by the time you click on this number, it will be highlighted. But this one is not highlighted because I use manual referencing. The advantage of manual referencing is that by the time they ask you to correct some things and you want to be rearranging, you are going to find it very difficult. But if you are something that like we are competent with all this work and you know how you go about it, you not have any issue. And another thing that's very, very important is the ability to be able to use Microsoft Word. You need to know that as well. So then okay, yes, lastly is questionnaires. How can we create questionnaires? So questionnaires, when you want to create questionnaires, you use specific objectives. So the method of creating questionnaires is not difficult. Just know your objectives, then you are good to go. Now, if you want to create any questionnaire, yes, we have AI. So you can use AI, but you have to take note of because AI will just come up with any form of question. So what is very important is you go back to the research work, look at their tables. Like this one now, is talking about perceptions. So these are the questions. You just extract all these ones out. Yes, if you don't like it that way, you can rephrase. So these are questions for perceptions. So let's say you need knowledge. Okay, this one is on knowledge now. So look at this. So just extract all this out and then put it into your questionnaire. But mind you, when you want to write your questionnaire is usually divided into like 3 or 4. It depends. But the first one that is very important is social demographic. Social demographic is very important. So the name and the date, the age, sex, level of income, and so on. So that's that about that. So I think, okay, in conclusion, the basis of writing a project is to understand that there's connection between the specific objectives of study, as I've rightly said, review of previous studies, proper analysis, and the discussion. So therefore, it's very important to be able to create relevant specific objectives of study, review the previous studies, and do proper analysis. I don't think I'll be able to do more than this. So if anyone maybe probably has anything to ask, you can DM me. I'll put it together. So thank you.